Hi, my name is Kayla and today I'll be talking about the labor and delivery field as a whole, the knowledge we've inherited over time, where that's led us to today, and whether or not that's been beneficial or not. So prior to the 19th century, it was predominantly women's business, and midwives would assist mothers to do what they were innately made to do. And then it wasn't until the mid 19th century that physicians started to take over the practice, saying that it was dangerous and needed medical attention. And so their motives were kind of selfish because they wanted the financial benefits of the labor and delivery field rather than the actual medical benefits of it. And they would lure women to the hospitals by saying to take a rest at the hospital for a week and be away from the home and the family and the stresses of life, and also to come and have new technologies and also new medical treatments to relieve pain and have a pain-free childbirth. So they would use combinations of chloroform and ether to actually drug the women to help fog their memory of delivery. And it wasn't until like 1914 that they used this German technique called twilight sleep, where they would actually mix morphine and scopolamine, which instead of deleting pain, actually completely fogged the woman's memory of ever even having the birth. And so she actually had no recollection of delivering the child. So this actually increased the risk of hemorrhaging, slowed contraction, and depressed the baby's breathing, which were all very negative side effects of having a pain-free delivery. And women were submitting their power to the male physicians and completely taking the birthing process out of their hands. And after such harsh practices, the women's movement was underway, and women wanted to bring the power back to the mothers. And so in 1970, the natural birth movement was very strong, and some mothers were even criticized for not wanting to have births at home. And if they had births in the hospital, they would be criticized, saying that they didn't know what a real birth was. In 1980, there was a question for the harsh medical tactics of the hospital, and many women started wondering if it was actually beneficial to have hospital births. And in 1996, the World Health Organization actually called for an elimination of all non-necessary medical intervention during birth. So unless it was necessary, it was supposed to be as natural as possible. So women started demanding that the hospital policies actually be changed, and that the rooms were more personal and that they could form their own birthing plan. And if they wanted to have a water birth, they could. And so it wasn't as harsh as the past practices. And so we kind of reached a happy medium of women having births in hospitals, but still being able to have the control over what happened with them and their baby. Today, we stress a lot of prenatal care, testing during pregnancy, and also fetal monitoring. So a big thing that we do during the pregnancy leading up to the delivery is additional folic acid. So this actually decreases the chance of neural tube defect, and additional vitamin D actually supports the immune system of the baby and also new cell growth as the fetus develops. Another important thing during pregnancy we do is ultrasound monitoring. So just checking up on the progression of the fetus as the birthing process goes along, and the pregnancy. And so finally, another thing is the RH factor screening. And so if a mother is an RH negative mother and the baby is an RH positive baby, during the birthing process, some of the blood of the fetus could come in contact with the mother, which could make the mother produce antibodies for the RH factor, which isn't dangerous during the first delivery, but if the mother continues to have children, it could be dangerous if she had another RH positive baby, because the antibodies that she has developed from the first birth could attack the fetus cells and cause the demise of the fetus. So to prevent this, we can now do injections to keep her from producing the antibodies and prevent future pregnancies from having complications. Also, the pain relief we use today is much different from the past, and so we use epidurals, which is actually a catheter put into this membrane around the spine, and an injected medication that numbs the woman from the waist down. We also use spinal blocks, which last about 2 hours, which are just an injection rather than a catheter. So things that are not utilized today that were in the past are forceps, which were salad-like tongs that were used to navigate the baby's head out of the pelvic cavity, which could cause damage to the baby's face and brain and head. So we no longer use those. And we also no longer use a tactic called epissiotomy, which was a small incision made on the mother to help prevent tearing, which actually just led to more complications in the end. Something also a little different is our postpartum care that we do today that we didn't necessarily do in the past. So there's additional trichognomic acid added into the mother's system afterwards to prevent excessive blood loss. And also really stressed is the golden hour. So the golden hour consists of skin-to-skin contact where the mother and the fetus are directly on each other's chest, and so that helps the baby's heart rate regulate and also the baby's breathing get regulated. Another thing of the golden hour is delayed cord clamping. So the cord is actually not clamped directly after birth, which allows more blood from the placenta to the baby, which increases the baby's blood volume. And then also delaying of non-immediate tasks so that the fetus can have more bonding with the mother directly after delivery. And newborn assessment is done on the mother's abdomen rather than in a bed or an external unit, so that the baby and the mother can bond further after delivery. So whether or not this is beneficial or not is very subject to opinion, but overall we can clearly state that the infant and the baby and the mother mortality rate has significantly decreased over time. So that has been beneficial overall for our society as a whole. And so women are continuing to have children, and we will continue to make advancements in this field. So it is our job to just continue our growth and development as a society to help mother and baby be successful. So thank you so much for listening, and I hope you really enjoyed this. So yeah, have a great day. Bye.